Hey everyone, Dr. Luke Peterson here, physical therapist with the Knee Replacement Therapist. In this episode of the Knee to Know Show, we're going to talk about sleeping position, especially looking at, do you have to keep your knee straight when you're sleeping after knee replacement surgery? So this is a really common piece of advice, and I see probably almost every surgeon, every physical therapist that I talk to almost will say this piece of advice, that you want to keep your knee straight when you fall asleep at night early on after your knee replacement. Now, this idea comes from studies that look at prognosis and outcomes and effectiveness of knee replacement surgeries or knee surgeries in general, and they show that the ability to restore your knee extension or your knee straightening range of motion early on after surgery is a really good indicator of having a good outcome of your surgery in general. And then this kind of idea was molded and changed and morphed into the idea that now when you go to sleep at night, we want to keep your knee perfectly straight. We don't want it in this bent position, because if we have it bent, it's going to lead to stiffness, tightness, and just decreased ability to straighten the knee and get that knee extension back. However, there have been probably 4 or 5 studies that have come out that look at the position of the knee while resting, so when sleeping, when sitting, when laying down, things like that. They look at the position of the knee and its effects on rehab and recovery. So they compare individuals who rest with their knee in a bent position. So some of the studies look at about 30 degrees of knee flexion or knee bend. Some even look up to as high as 90 degrees of bend of the knee. And they're looking in this period, this kind of acute period after surgery, so the first 48 hours to that first week after surgery. And they compared this to individuals who in resting positions have their leg and their knee completely straight, or as straight as possible. And they found that the people who rest and sleep and lay with their knee in a bent position showed a decrease in blood loss, a decrease in swelling of the knee and the leg, and improved knee bending or knee flexion range of motion early on in the recovery process. And what they showed after you move away from that recovery process, that there was really no difference in terms of range of motion or swelling or pain levels for the individuals who had the knee bent or had the knee straight. So it seems to be, if we look at the research and look at the studies, there's actually some good benefit to resting and sleeping with the knee with a little bit of bend or a little bit of flexion. This, again, helps reduce blood loss, helps reduce swelling, and helps improve your flexion or your bending range of motion. So feel comfortable, feel okay, don't get nervous or afraid if you want to sleep with your knee with a little bit of bend. I usually recommend, trying about 30 degrees. Getting up to that 90 degrees is really a significant amount of bend, a significant amount of flexion. But as long as you're also doing your physical therapy activities, you're getting up and walking, you're working on the extension exercises and the bending exercises, I think it's appropriate, especially in that first 48 hours, that first week or so, to sleep and to rest with the knee in a little bit of a bent position. I would encourage you to have a little bit of elevation, so elevating it up on some pillows just to help with that swelling a little bit more with gravity, bringing that swelling out of the leg. But perfectly okay and perfectly all right, in my opinion, and based on the research, it seems to be beneficial to have that little bit of bend. I hope you found this video insightful. Please be sure to hit that subscribe button and turn on the notifications if you don't already. Be sure to leave your comments and questions below, and I'll be sure to get back to you. Thank you for watching.